Perhaps you have a personal history of cancer and you're concerned about whether or not it runs in your family. Or maybe you have several other family members who have cancer and you're worried about whether or not you may be affected with cancer. Someone may have told you you need to think about genetic counseling. So, what are genetic counselors? Genetic counselors and genetics nurses are highly trained individuals with a master's degree and specialized training in genetics as well as counseling. They're trained to help evaluate your personal, medical, and family history to determine whether or not genetic testing might be appropriate for you. Some of the things that we look for are cancer diagnosed at an unusual age, several types of cancer in the same individual, for example, bilateral breast cancer or more than one type of cancer. We look for cancer in first degree, second degree, and third degree relatives. These are parents, siblings, aunts, uncles, grandparents, first cousins, and we look for patterns in those cancers to determine whether or not, again, it looks like you might be at an increased risk for hereditary cancer. We look for unusual or rare cancers. These are things like endometrial or uterine cancer or ovarian cancer. Those are cancers that don't occur that often in the general population of women. So when we see them, it's a red flag that there might be something else going on. So genetic counselors and genetics nurses look very carefully at the family history to determine whether or not we need to discuss genetic testing with you. It's very important that prior to your genetic counseling appointment, you gather as much family history as possible. We need to know specifically who in your family had cancers, what age were they diagnosed, did they have any genetic testing, and if so, what were their testing results, and any other information about your family that appears to be concerning to you. By evaluating this family and personal and medical history, we can then determine the next steps and help guide your care. So, genetic counseling is a process that can empower you to make informed decisions. We'll address your questions and your concerns about hereditary cancer risks, prevention, and management.